Hi there, everyone. I'm Randy Murphy, epidemiologist and director of disease surveillance at the Mobile County Health Department, here to give you our daily update on the impact of the COVID-19 pandemic around the world and especially on Mobile County. So worldwide, there are about 8.4 million cases of COVID-19 disease, with about 450,000 deaths worldwide. In the U.S., we are seeing 2.2 million cases of COVID-19 disease, with around 117,000 deaths. In Alabama this morning when I checked, we had gone over the 30,000 mark with the number of COVID-19 cases. 531 cases were added just yesterday across the state, with about 800 deaths. In Mobile County today, we're reporting on 2,857 patients with COVID-19 disease. We added 36 yesterday to our daily case count. Most of those are laboratory confirmed. 22 of them are classified as probable COVID cases. We added 2 new patients hospitalized with COVID disease yesterday. That brought our total to 271. And 1 new COVID patient who died from the disease was added yesterday, or reported to us yesterday, and that brings our total to 132. And you know, I look at these data all day, every day, sometimes late into the evening, and I just, I'm super sensitive that an epidemiologist or a data scientist like me, I refer to these as counts and numbers, but these are our patients, they are family members, they are brothers and sisters and parents, and it's just tragic, and we have sympathy for the families that are impacted by this deadly outbreak, particularly those who have family members who have experienced severe complications and deaths. So these are not numbers, these are people, and there are community members that we're talking about and that we continue to try to protect by following our social distancing, washing hands, maintaining a 6-foot physical distance from other people outside of our family members, staying at home if we're sick, and wearing the cloth face covering. So I wear this to protect the most vulnerable community members, those that would become much more ill than I if they were infected. And I want to protect people from my germs by wearing my face covering to protect those around me more so than myself. Just wanted to comment, we have been seeing, because things are improving in our nursing homes and we're seeing less hospitalizations and deaths among our older populations, the new cases that we have been adding over the last couple of weeks are primarily in younger people. So like in that sort of 20 to 50 category where we're seeing the most growth in the numbers of COVID patients diagnosed and reported to us. And this is a representation of what we call community-based transmission. So person-to-person transmission that's happening in the community setting, not in healthcare facilities or in nursing homes. That is what's driving our outbreak. And we continue to see, a gradual increase in the number of cases associated with community transmission. And again, they're in those younger age groups, people that are, 20 to 50 years old, who are healthy, who would have a very mild illness if they had no underlying conditions, but that can spread it to others very easily if they're not following the safer at home recommendations when they're out in the community. So just to, hopefully implore or beg your participation in helping us protect the community by social distancing and taking other prevention measures when you're out in the community to try to protect those that are the most vulnerable. So with that, we'll get into a couple of questions posted on Facebook and provided to us from local media outlets. the first one here, it's commenting on a spike in numbers over the weekend. Well, the spike in number over the weekends primarily was due to the transmission going on in the middle part of our state. So Montgomery County and the surrounding counties have seen a tremendous increase in the number of cases reported. They are attributing that to community transmission. We no longer have the most COVID-19 cases in the state, so those spikes that occurred statewide over the weekend we didn't see the same thing in Mobile County. Still, we are concerned that people seem to be relaxing attitudes about the serious nature of the pandemic, and it is concerning for us, and we want to just make sure. We think that our sort of slow, steady rise in the number of cases and us not seeing a huge spike over the weekend like was observed in the other parts of the state, we attribute that to our safer at home orders and the recommendations to prevent community spread have been helping us, and some of the things that we did early on have kept us in a much better situation than some of our counterparts. So we want people to continue maintaining a 6-foot distance, wearing your face covering, washing your hands, covering your cough, disinfecting surfaces, staying at home if you're sick, doing those things, because we would like to continue to keep it low. The next question was, do we think we're in a second wave of the virus already? And we're not out of the first wave. We are still in our first wave. Yes, we have been successful in Mobile County in recent weeks to slow the increase or the community spread, but we're not out of the woods yet with our first wave. So no, we are not in a second wave of the virus. We have to get past the curve. We have to see the number of cases go down steadily over at least a 14-day period before we can declare that we are over the first wave. And once we're at our very low number of cases for a period of weeks or months, then if we see them start to increase, it will be a second wave. But that probably, we hope that won't occur until the fall or the winter. The high numbers in other regions, I believe, are primarily due to just an unwillingness for community members to do their part in maintaining social distancing and wearing a face covering. I have just heard anecdotally that from people who live in some of the other areas of the state that they know that people are not taking it seriously, and it is showing up now in the very, very alarming numbers of cases that are being reported along the middle part of our state. All right, next. How are we faring in terms of first responders? Do I have the numbers on first responders that tested positive, and what is the protocol? I do not have the number on first responders. I think that the testing of first responders was something that was an effort by the city of Mobile, and we weren't directly involved in that. See, Mobile County's daily COVID-19 case count is well below a model that was published by Children's Hospital of Philadelphia. Do I concur that people adhering to rules better than a month ago, and how worried are you about mid and long-term outlook? So yes, we do believe that the social distancing, the restriction of movement, the restrictions on businesses, we believe those things have worked in Mobile County, and we had a really tough start. We had lots of cases in the beginning when testing first became available. But now that testing is widespread and we're seeing sort of a modest increase in the number of positive test results week over week, yes, we attribute that to the early and important prevention measures that the State Health Department and the Mobile County Health Department supported to flattening that curve. We kept talking about all of this is to flatten the curve, and it seems like that is what has happened. So keep it up. Please keep it up, because we are not out of the woods yet with the first wave. All right, I think that answers that one. Here is a concern about daycare providers wearing masks or practicing social distancing. Yes, in the state order, the amended Safer at Home order It states that employees, staff at daycares shall wear facial coverings. That is an order, not a suggestion. And we have heard that many daycares are not complying with this order. If you have a particular daycare that you are concerned about, you can let us know, and we may be able to reach out to them now. We didn't have this capacity more than just a couple of days ago, but we're trying to step up, going into permitted establishments and educating and informing on what the language of the state health order means. And for daycares, that means that employees shall wear face coverings. All right, then here's a question to say, if you're not sick or showing symptoms, why would a healthy person wear a mask as long as they practice social distancing and hand sanitizing? Here's the reason. We know that people can be infected with COVID and have no symptoms. We didn't know that 2.5 months ago. But now we know that there is such a thing as being infected with the virus, being PCR positive, but having no symptoms. If you have a PCR positive test from a sample that was taken out of your nose or in your throat, it means that that virus is in your nose and throat and mouth, which means that even though you have no symptoms, if you're PCR positive, you will expel virus when you talk, cough, sneeze, or sing. And those virus droplets can wind up on people's faces, on their hands, on surfaces, and that's how you can unknowingly transmit coronavirus to other people and infect them. So that is the reason why it's still important, if you have no symptoms whatsoever, that you wear a face covering. And then this last one here, it's not really something that the question is, can you address the national message sent by the president that we no longer need testing? And I do not know, I haven't read the president's statement on that, but for me, testing is still one of the most important tools in our toolbox. We don't have treatment for widespread treatment. There is some treatment that is improving negative outcomes in people who are hospitalized and in the ICU. But for average people, there's no treatment. We still have no vaccine. We still have an entire globe of people that have never seen this virus before and have absolutely no immunity. So one of the few things we do have is a really good PCR test. And having the knowledge that that test result brings is super important to me, and I will continue advocating for the widespread use of that test for people who are symptomatic, for close contacts of people who are symptomatic or who test positive, and for anyone who feels like they need a PCR test, or for COVID. I mean, we haven't always been able to offer testing, and now that we have it, we really want people to take advantage of it. So you can call the health department at 251-690-8889 if you just are feeling unwell, or if you're concerned that you might have been exposed, or if you have symptoms, whether you can pay or not pay. Call us and we will schedule an appointment for you to get a PCR test. And that information is extremely valuable to us, to the health department, and to, as we continue to learn and make recommendations about prevention activities to protect our community from COVID-19. So I will be in the field tomorrow. I will not be here to give the 2:30 update, but my colleague, Ms. Pebble Kings, is expected to be here to provide a report, and you can look forward to that, and maybe we'll talk to you again next week. Thanks, everyone.